For years, I've had a passion for architecture and real estate, and I love meeting new people. This combination led me to get into the business of helping people buy and sell homes while also contributing to our local communities and promoting the businesses within them. I'm Andy Stavros, and this is a Stavros Snapshot. We all love our pets and always want to make sure they're in good care. On this episode of the Snapshot, we're less than a mile up the canyon from downtown Laguna Beach at Laguna Beach Veterinary Medical Center. Let's go inside, meet Dr. Bondurant, and hear more about what he has to offer for you and your furry little family members. Hi, Dr. Bondurant. How are you doing today?
I'm great. How are you?
Doing great.
Good.
Thank you for having us today.
Thanks for coming.
Dr. Bondurant, I know my animals are in great hands with you here, and I wanted to share with our viewers the services you provide. But before we do that, can we get into a little bit of a history of what landed you here in Laguna Beach?
Of course. I moved here in 2011. I've been a veterinarian for 30 years, so I graduated from Auburn University in 1985 and practiced in Atlanta for 25 years. But my kids started coming out to school to USC, and as each of them would come to school, and I have 4 kids, so as each one would come, they would stay after they graduated, and so the pressure started building for us to move out here and to make California our home. So I moved here and bought this practice in 2011, and it's been great, of course, being in Laguna Beach and being close to the beach and close to the canyons, and just a beautiful setting to practice in.
Absolutely. Well, we're so glad you made it here. We thank you so much. Can we go in back and start getting into the services that you provide?
Of course, I'd love to show it to you.
Okay, Dr. Bondurant. So if one of my dogs isn't feeling well, what is the first step when we come here?
So we're standing now in an exam room, and when a pet is sick, generally you would call and say, hey, he's not feeling well, and they would schedule an appointment for you to bring him in. So you would come in at that time, and we would bring you into this room, this exam room. So you would be with him during that process, where we would, take the vital signs, do a complete physical exam. You might say, his stomach's been upset, and we check certain things that way. But the exam room is where you would stay with the pet. So we're doing all of this here. In this exam room, this tabletop is a scale. But a lot of times, like with the bigger dogs, I lower this, and I see the bigger dogs on the floor. They get a little scared when you lift them off the floor. They're not used to being like up high like that. So a lot of times I'm down on the floor with the pet. I try to not rush, I want to take it easy, let them get comfortable, let them relax. A lot of times we're just having conversation with the clients to let the pets relax a little bit. Then they'll let me look at them better. They're relaxed, they're more soft and pliable and that sort of thing. So that's kind of what this room is used for.
Great. Well, it's very soft, very inviting. I'm sure the pets are as comfortable as can be in this room.
Yeah, that's what we strive for. We want to lessen the fear and the anxiety. I think it's just better for the clients and better for the pets that way.
So we have a little bit of a farm at our house. We have 2 dogs and a cat. We know what happens if one of the dogs isn't feeling well. What if the little cat's not feeling well?
So when the cats come in, we use a cat-specific exam room. It doesn't smell like dogs. It doesn't have loud noises. It's a little different surface that the kitties are placed on. We use a small scale, of course, to weigh them. So we do use that. We also use pheromones, which people laugh about that, but we find it's a calming effect for the cats. If we spray the room with this cat pheromone, when the cat smells that, it helps them relax a little bit too. So again, all of these things just to lessen the fear, lessen the anxiety, make it more pleasant for the patients and for their owners, because I see the stress and the anxiety in the owner too. The cat's upset, they're worried that the cat's going to respond or bite or scratch or something like that, but generally they did great. We have very little problem.
Well, fantastic. Seems like you've taken all the necessary steps to make sure the atmosphere is as comfortable as possible.
Yeah, that's what we really strive for.
So as we're walking through, I see quite a bit of medication and some equipment. Can you tell us what we have here?
Of course. So most animal hospitals, and this one especially, have their own in-house pharmacy, their own in-house lab work capability. And we like that because we can provide what the medication pet needs immediately. We can run lab tests immediately, have results within minutes instead of having to send it out to the lab and wait for results to come back. So it's really nice that we have these capabilities to provide things quickly for the pet and for the owner. full pharmacy, all the medications that we would need to treat. The blood work, again, we can draw it and run it, have results within minutes instead of overnight or hours. So it really is all for the pet's benefit, to try to give them the best care in an expedient and helpful manner.
Absolutely. Expedient, efficient, great for the pet, great for the owner as well.
Right, exactly.
And who's this little guy down here?
This is Ollie, and he's actually in our critical care cage. This cage can be warmed on the floor there to help elevate their temperature if they're too cool or post-surgically. These cages actually provide oxygen if they're having a problem breathing, if they have a heart problem or something. We can dial in the oxygen, the humidity, all of those things can be adjusted to help them. So it's really nice to have that we can provide the needs for more of a critical type case to provide the oxygen and the warmth and things that they need. So this is our x-ray room, and we have digital x-rays now, which is great. When I started practicing in 1985, we used dip tanks. So you can take the x-ray, take the film out into the dark room, put it in through the fluids. Now you take the x-ray and immediately you look at what you're seeing. You can also manipulate the digital image if you want it a little darker, a little lighter, if you want to zoom in onto a certain area and evaluate that organ or that bone a little bit better. So digital has been great. It's really, you don't have to retake as many x-rays, you don't have all the chemicals and all those other things. It really provides a lot of speed and additional care for the pets.
Wonderful. It looks like a very advanced piece of equipment and very clean. Thank you.
Yeah, of course. Okay, so now we're in what we call our treatment room, and of course we have a treatment table and we have various medications and things. These are some of the cages in the treatment room. We have Tika and Rue, and they're basically just boarding with us right now. It's during the holidays. We find some pets do a little bit better if they're closer to people because they're used to being with them, so we'll keep them up here in the treatment cages. Over here we have a kitty named Burley who just had bladder surgery. He had some bladder stones, so we went in to get surgery on him. Looks a little bit sad wearing his little cone of shame, but that'll get to come off here pretty soon, and as he wakes up and kind of gets his bearings back. But he's doing real well. Surgery went well for him.
So if I'm going out of town and I have absolutely nowhere to leave my 2 dogs and a cat, you have a safe facility for them to stay overnight for multiple nights if needed?
Right, exactly. We have, we have cages, we have the runs we'll show you, which are larger areas for larger dogs, and it does provide a clean, safe, warm environment. They all stay inside, but they get walked as many as 3 to 4 times a day. They get to go outside, and we have a grass area to the back where they can relieve themselves and just get some fresh air. The staff is super attentive. They note every morsel they eat. They note every urination, bowel movements, all their habits are totally evaluated and documented while they're here. So we really try to take good care of them. One of our staff was calling today, just randomly calling the clients to let them know they're doing well. Calling them on vacation and saying, hey, they're doing great. We know you're picking up on this day and that. Has that changed? So it's just a good service that people find that they know their pets are well cared for and they know they're safe. So this is our surgery suite, and it's really very well done. It has some of the state-of-the-art lights that provide, the surgical lighting. We have a heated table to keep their bodies warm during the surgery. Of course, everything is very aseptic and sterile when the surgery is done. The surgery packs. We also have a laser unit that we do a lot of our surgeries with laser. It provides more comfort to the incision. There's less bleeding, less swelling. So it really is, again, one of those things that just help the pets as they recover from a big surgery like that. Surgery is one of the things that I really enjoy, and I tend to do a lot of surgery and everything from orthopedic to soft tissue type surgeries. So this is a bit unusual, something you don't see in many small animal practices. It's an actual dental suite for pets. So we have a treatment table that does lower and raise. It has a scale in it. Of course, it's a wet table because as we clean teeth, there's a lot of water and fluid that's being used during that procedure. And we have also digital x-ray for the mouth, and it's specifically for veterinary usage, small teeth, small mouths, and that sort of thing. But again, great that we can take that image and look at that tooth immediately to see if the root's damaged, whatever's going on under the gum line. What we see above the gum on the crown is only part of the story. We want to know what's going on underneath there. We offer 3 levels of teeth cleaning. We do offer a non-anesthetic teeth cleaning. Sometimes when it's just some buildup and we want the teeth to be clean and to keep the gums healthy, we don't need anesthesia. And we have technicians that are specifically trained to clean the teeth without anesthesia. If they're a little bit anxious, a little bit nervous, we have a sedative teeth cleaning. So we can just relax them and kind of just take the anxiety and the fear away so we can do a little bit better job cleaning their teeth. And then if there's extractions or some major oral surgery or dental work, then we anesthetize them, and this is our anesthesia unit. We of course monitor them with full EKG, blood pressure, oxygen saturation, throughout the procedure, so we know that they're safe and they're going to do well with the anesthesia.
Fantastic, nice room. It looks just like the room that I would be in when I'm getting dental work done.
You're next, hop up.
Dr. Bondurant, thank you so much for your time today and the wonderful tour. Before we leave today, is there anything else that you would like to share with our viewers?
We have an isolation ward. If a pet is really sick with a transmissible disease, we have an area to separate them. Of course, that's good for those that stay here and good for the ones that need that. We also have separate cat boarding with cat condos where they can move through separate layers and little portals, kind of keep them interested that way. And then of course we have the inside dog runs too, which are nice, those big nice areas there as well. So yeah, those are just the types of services that we offer. We want to take the best care that we can for the pets and try to make it as comfortable and give them a good environment to heal and to stay.
Great, well thank you so much for sharing.
All right,
have a
thank
wonderful
you.
day.
All right,
we'll see you
come
soon.
Back. Sounds good.
Thank you for watching. I hope you enjoyed this video. If you did, please like it, comment on it, share it with all your friends. More importantly, if your pet is in need of some care, come visit Dr. Bondurant, help support his business. And when you're driving down the canyon, just make sure to pay attention to the Dalmatian mailbox on the side of the road. If you have a local business and want to be featured on one of our next episodes, contact me. I'm Andy Stavros, and don't forget, who sells your home matters.